are the most important vitamins for mental health? My name is Dr. Ruth Dutton. I'm a board certified adult psychiatrist and a metabolic psychiatrist, which means that I look at the overlap between mental health and metabolic health. And there are a number of vitamins that play key roles as cofactors for a lot of the chemical reactions that need to happen in your neurons or brain cells in order for your brain to be functioning optimally. Some of the most important vitamins are vitamin A, the B vitamins, so things like thiamine, niacin, vitamin B6, folate, vitamin B12, vitamin C, vitamin E, and vitamin K2 are also all important vitamins. So let's talk a little bit more about each one. So vitamin A is important for your vision, for your circadian rhythms, as well as for forming memories. It's present in a lot of plant-based sources. Think those bright orange vegetables, things like carrots, squash, pumpkin. And a deficiency is not common because vitamin A is going to be in the fortified foods that we eat. The B vitamins is kind of a complex topic, but essentially they work together in order to extract energy from the food that we eat and to build vital molecules. Like I said, these include thiamine, riboflavin, vitamin B6, folate, and vitamin B12. We can commonly test for thiamine, folate, and vitamin B12 deficiencies. And so I recommend supplementation if you're found to be deficient. People who are at risk of being deficient are going to be people who have a vegan diet or people who eat a lot of ultra-processed foods, not many whole foods. So if you fall into one of these camps, a vitamin B complex might be helpful. Vitamin C is vital to build collagen, as well as a role in neurotransmitter synthesis and functioning. It also has antioxidant properties, and it's found in a lot of plant-based foods, so things like peppers, citrus, orange, lemons, etc. Of course, there can be risks to excessive vitamin C use or supplementation, so if you're getting these things in your diet, you don't necessarily have to add an additional supplement. Vitamin D is crucial for brain cell growth and development. It helps to protect the brain cells from damaging oxidation, and it helps support the health of the hippocampus, which is the memory center of the brain. We can easily measure vitamin D in the blood. We're checking vitamin D3, and although levels of greater than 30 are going to be technically normal, we recommend optimizing to 50 or greater for ideal brain health. The dosage you take is going to depend on where you're located, the time of year, how deficient you are. So obviously, if you're somewhere where it's cold most of the year, you're not getting a lot of direct sunlight exposure, then you may need a higher dose or to take vitamin D supplementation for more months of the year. This is the only vitamin supplement that I take. I just take this one, Nature Wise Vitamin D, primarily because it's one of the cheapest. You can get like a whole year's supply for $15 or less. So I take 5,000 international units, and that's because I have tested deficient in the past. When I take this, my level went from 20 something to 49. Sometimes it can be helpful to take with vitamin K, which I'll talk a little bit more about later, but there can still be benefit to taking it on its own. Vitamin E is another antioxidant. Deficiency is pretty rare in those who don't have issues absorbing fat because it's a fat-soluble vitamin. It's found in a lot of things. So those that might be at risk of deficiency are going to be those people who may have issues absorbing fat, like maybe they had a gastric bypass, or if they're just extremely malnourished. Again, supplementing too much vitamin E does have risk. There can be increased risk of bleeding due to the inherent anticoagulation properties of vitamin E. And lastly, vitamin K2 is required to build cell membrane components called sphingolipids to support the overall health and function of your brain cells. Like I mentioned, it works well with vitamin D in order to regulate calcium levels. And foods that are rich in vitamin K2 are going to be things like liver, animal fats, and eggs. Now, before you go out and buy a whole bunch of supplements, keep in mind that it's best to get these nutrients and vitamins from your food. Your body's better able to absorb them this way, and you're going to be getting these nutrients in conjunction with protein, fat, fiber, other things that your body needs. So if you have a good quality diet full of whole foods, there's not necessarily any reason to supplement any of these unless you know that you have a deficiency. There is some evidence that very large doses of high quality multivitamins can bring about improvement in mental health, symptoms like depression. However, this is prohibitively expensive for most people. And there are, as I mentioned, risks to taking too many vitamins. And so I generally don't recommend this approach. The only vitamin that has some evidence for its efficacy in people who don't have a deficiency is folate. So if you want to try supplementing this to see if it helps with your mental health, it's probably not going to hurt. It's important to keep in mind that those who have a certain MTHFR mutation are not going to be able to methylate folate and other B vitamins in order that they can be active and metabolized in your cells. This mutation is relatively common. It's also expensive to test for, so it's probably just easiest to get a methylated B vitamin rather than just folate. I know this was a lot of information, so if you have any questions or concerns about any of this, feel free to put in the comments below. I'll also add the link to the vitamin D supplement that I take if you want to take a look. But hopefully this was helpful. Wishing you all good mental health today, and I'll see you in the next one.